Healthcare Source being specific to healthcare really was a key factor for us. In our demos, we determined that they offered a lot of the things that we were looking for, and then other things that we didn't even know we wanted, and in retrospect are some of the biggest assets of the system. When we were looking at Healthcare Source specifically for Performance Manager, we were tasked by our CFO to evaluate systems for the purpose of utilizing one vendor as opposed to multiple. So if we were going to implement with Healthcare Source for Performance Manager, we were going to have to for our applicant tracking system and those types of things. So we did just that. We implemented both Performance Manager and Position Manager. We were already utilizing staff assessment. And it's grown from there. So we've since purchased leadership assessment, and we're in the process of reviewing or going through the contract approval process for the reference assessment. Our hiring managers and our employees having one system, one set of credentials, kind of a one-stop shop for performance, job descriptions, applications. It benefits everybody because they're more likely to use the system because there's multiple purposes for them accessing those systems. Increased familiarity leads to less questions, so it's less administrative work from an HR perspective. So currently we utilize Position Manager and Staff Assessment, and we have those systems integrated, and we have them integrated in a way that when an applicant submits an application within our system, they're required to complete that staff assessment. When they complete that staff assessment, what that does is it provides us with a consistent interviewing tool for those candidates. So when we route that individual onto the hiring manager and the hiring manager determines that they're interested in interviewing that candidate, they have an interviewing tool that the hiring manager can access within the system. We don't actually have to send them that assessment tool. The hardest task is determining who's the best fit for the department, and the staff assessment and leadership assessment allow us to do that. Having that relationship with Healthcare Source is really gratifying because it makes us feel valued as customers, and we know that they respect us and understand that we have to do what we have to do, and who knows better how to do the job than the people that are doing it day to day. And so they're creating a system that allows us to do that most efficiently. So they are constantly looking for our feedback and input to make their system as good as possible, because if their system isn't improving, our processes aren't improving, and if our processes aren't improving, there's less value that they give to us. So we feel great about that relationship. Finding the best fit candidate is important from an employee morale perspective, from a retention perspective. So if you find those individuals that are a fit in your department, they're going to stay longer because they're going to enjoy their job, they're going to enjoy the people they work with, they're going to enjoy the atmosphere, and so it's going to reduce our retention or increase our retention rates, and it's going to ultimately reduce the costs of employment, because an empty position is that much less service that we can provide to our customers.